You have to be read too. Yeah. Welcome everyone. Welcome to our Zero-Dose Learning Week. First day of discussions. This is the first day that we're going to have a lot of dissemination of the lessons learned, the findings, and the different recommendations from not only the call of abstracts, but also from leading learning consortia working on equity and zero dose. Thank you all for joining us today. We're going to have a very packed agenda with a lot of presentations, a lot of discussions, useful discussions. And I really appreciate all the excitement, the enthusiasm, and the contributions from all the Alliance to this day. We received a lot of evidence, a lot of contributions, more than about 200 abstracts, and useful information that is going to help Gavi to adjust its kind of strategies, its programming guidance, and be in a much better position in the future. So really thank you to all the Alliance contributions. Thank you all for joining us today in the virtual environment and here in person, our panelists. I'm going to call now Hope Johnson, our MEL director, the Measurement, Evaluation, and Learning Department director here at Gavi, to give some opening remarks, followed by Alex de Jonquière, the director of the HSIS team, the health system strengthening team. Yeah. So with that, Hope, please, thank you.
Good morning and welcome. We're super excited to have you here to the first Zero-Dose Learning Week. And I have the pleasure to be able to kick off this exciting event, both online and in person. And we sincerely thank you for taking the time to prioritize this, as well as all of those who've contributed to make it happen, which it sounds like it's been a lot of people coming together. I have to say, Learning Days are one of my most favorite things. It's just a really exciting kind of a milestone event where you kind of put a line in the time and come together as a community to pause and reflect, understand how things are progressing with evidence generation. What are some emerging insights? What kind of more robust information do we already know? And then to jointly synthesize these learnings to think about how we would use these, because the utility is really critical for this. For us, we use this for course correction in terms of both our evidence approaches. So there's a lot about methodologies and trying to get the right methodologies, but even more importantly for our programs. And for Gavi, as we're less than a year and a half away until the end of this strategic period, trying to understand what we could more rapidly scale in terms of proven intervention. So this is really timely for us. We're really excited about the enthusiasm and the commitment of the community to make this come together. And we think this will help us to really set ourselves up as a community to both deliver on the evidence, but to support delivery on results. The learning for the zero-dose programming is coming at an important time. We've catalyzed a lot of evidence. I'm also one of the editors for the vaccine supplement, which will be coming out later this month on inequality and immunization. And it's just, I think about when we started this period, I actually had done a Google search to see how many times, kind of zero dose and equity came up before Gavi 5.0 started. And then to think about it now, I mean, what an amazing accomplishment to have this many great people coming together, really trying to focus on a really difficult problem and trying to help find ways to address barriers to reach those missed children and communities. And we know that this was an issue that was even exacerbated with COVID-19, and we're seeing increasing disease outbreaks. So those health systems are even more strained right now as a result of the immunity gaps. Some of those people we will be able to easily start to protect again through getting immunization services back on track and through our big catch-up activities. But others who were already facing barriers to immunization also face other deprivations, which might be further exacerbated in the current context, which we have, increased fragility and conflict, financial constraints, and the effects of climate change. So just to say, I think, there's a lot more utility from the evidence that will be generated and really at an important time. As many of you know, equity and reaching the zero-dose child are at the heart of the Gavi 5.0 strategy. And we had recognized that immunization coverage was stagnant at pretty high levels of coverage across the globe, but there were a lot of subnational variability in that. And to really be able to make those gains, because we had been stagnant for a long time, but we really knew we needed a more purposeful approach to this, because we kept consistently missing the same children and communities. And we recognized that at the outset of this strategy period, we didn't have all of the answers. And so for us, it was really important to put in place a good zero-dose learning program to really help us learn across the IRMA framework, and to utilize a variety of methods. We couldn't wait until we had the most robust evidence, so it was using measurement and analytics and different monitoring approaches, surveys and assessments, using whatever we can to be able to try to provide more timely and fit for purpose information to help us course correct, scale those best practices, and to enable cross-alliance learning. We had identified some priority questions at the time. It's kind of interesting to go back and reflect on those now, and looking forward over the next 2 days to see how many of those are already, we have some good insights on. The key questions that we started out with were just, where, who, and how many children are zero dose, why are they being missed, the effectiveness and key enablers and barriers to implementing the approaches across the IRMA framework, as well as the ERG settings. And I know I'm saying a lot of acronyms here, which I think you will learn more about these over the next day, because we will be able to see a lot more linked to these concepts. What are the most effective partnership and integration models to be able to reach these children? It's not very easy in some of these settings, and there's a diversity of and in terms of comparative advantage that different providers have at being able to reach and engage these communities. There were also some cross-cutting themes that we saw across those questions: cost and sustainability. What does it take to actually reach those children and to continue to reach them in a sustainable way? How does this differ in different types of contexts and typologies? And then what role can Gavi play within this to really make a meaningful difference? So to operationalize the learning agenda, we started out with a number of projects with a range of partners, and we'll hear from some of you all today. First, we started out with a measurement framework, so it was very much tied to our strategy level performance, but we cascaded that down all the way to our country monitoring approach. A real birth of different analytics, using lots of different types of data to be able to better understand the who, where, why, and how many zero-dose children. And then we had a monitoring and learning agenda specific to a program that we have called the Zero-Dose Immunization Program. And I know Amy Ratcliffe will present on this, where we were really trying to understand in cross-border regions, how is immunization happening? How can we be useful? And I would say this is a true learning. It's been a real learning experience, which we'll hear a bit more about today. And it's helping to inform our approach to fragility in humanitarian settings for our next strategic period. We didn't want to wait till all the new information was generated, and we realized there was quite a lot that had already occurred. So we had some case studies and retrospective evidence reviews of the information that was already available. And then we initiated our zero-dose learning hubs, which have been kind of a flagship learning platform for us. Which is providing us a bit more insight into, we're very far up in Geneva, and so to be able to really get more insights with more robust methods to understand what this looks like programmatically, and to see how we could better help countries. And then finally, we have a zero-dose evaluation, a multi-phased evaluation, which tries to bring together this different information to help us as an organization to think about how we've been operationalizing our approach and how we could strengthen that going forward. As a learning organization, we really try to make sure that most of what we do is grounded in evidence. And this kind of regular reflection, question, learning and adaptation is a key part of that. And this means acknowledging, failure. And I think the failure is how we learn more quickly to be able to get to where we need to be. These are complex problems. We're not exactly sure, as Gavi, of how exactly we can be the most useful. And so the learning is really an important part of that. And you'll hear about some of that kind of humbling learning over the next 2 days. The aim of this week is really to collate and synthesize the emerging evidence and lessons learned to help influence our strategies, policies, programming, and methods. There's a lot of you out there deploying different methods and being able to learn from each other what is really working. We have countries who are programming grants. What are the best methods to be able to address some of those questions so we can help them to get that into their grants so we can support them also on the measurement side. There are two main methods that we've used for trying to capture the emerging evidence for this learning week was our call for abstracts. And it was really a call that was enthusiastically met. We received 197 abstracts from 140 different groups. And so you'll see a lot of that information. And the 40 top listed ones were asked to submit posters, which we've had on display here over the past week. And it's been really energizing in our environment just to see some of this information and with our colleagues in the Global Health Campus, of which we're engaging even more closely, particularly because these children in these communities aren't only missed with immunization. So I think it's energizing for our colleagues as well. Today, we'll be focused on the dissemination of the findings and recommendations from the emerging evidence. And we'll hear the high-level messages and try to synthesize some of the lessons learned and recommendations. So we'll have our colleagues from University of Montreal to present the scoping review of the literature, which is a living scoping review. Our colleagues from Sabin will present the synthesis and findings and recommendations from the call of the abstracts for this week. We have our colleagues also from the Zero-Dose Costing Group who will provide the information that has emerged from that, which has been really useful to address one of those really critical themes that we had, just not understanding really what it takes to be able to do this. We also will have the lessons learned that are emerging from the zero-dose learning hubs. And looking at some of the sustainable solutions to the root causes of zero dose with our MRIGHT consortium colleagues. Our partners at the Gates Foundation have a robust learning agenda that they support as well. And so we will be able to see some of the key findings that are emerging from that, including from and in addition, the India Health Action Trust, providing insights on the PHC integration, which we know is a really important, trying to understand how to do that well is really critical, as we know that these missed communities and children are often not just missed with immunization. Amy Ratcliffe, as I mentioned, will present on our ZIP project, and then we will also hear from our Ipsos colleagues who have completed our phase 1 evaluation of our zero-dose work for Gavi, and are in phase 2 and starting to plan phase 3 of that multi-phase evaluation. So just want to say, I think there's a lot of rich information that will come from today, and we have more tomorrow. But I want to thank all of you who are able to attend. I know many have contributed across a large number of organizations who are represented here and online. So thank you for your engagement to help make this happen. We actively encourage you all to not hold back, to not just sit back and listen, but to actively ask questions and challenge and connect the dots between different pieces of work, because this is really, it's not just about what we produce these abstracts. It's about how we're actively trying to connect that information. What do we feel we more solidly know? Where do we think the gaps still are? And that will really help us for how we take things forward. We will make all the abstracts, poster slides, and materials, and the report will be made available in the coming months, and we'll plan some further dissemination and discussion through the end of this year, but we'll come back to this at the end. So I'll stop there and hand it over to my colleague, Alex.
Thanks, Hope. And you covered a lot of ground, so I will be brief. But firstly, maybe to explain why I'm coming after Hope, my team in the Secretariat, those that don't know me, don't know us, is responsible for really taking a lot of the learning and knowledge that's been generated out of this work, but more broadly on zero dose, and turning that into programmatic guidance, thinking support to countries, working with our alliance partners and with our senior country managers. So we are one of the key customers for this work. I'm very excited to hear about what's going to be, what we are learning and what we're going to learn. Maybe to step back to sort of the genesis of the zero dose discussions in 2018, 2019, because I think that we sort of forget that the reason we're doing this is because for decades we've struggled as an immunization community, but frankly as a health community, to reach these to reach zero-dose children and the communities in which they live. And it's inherently hard. And I think in some ways we've had this huge success of socializing, and Hope spoke to this, the zero-dose agenda, and that's really positive. And in some ways it's come almost business as usual, that, oh, well, of course, that's what we'll do, and we'll reach these children because that's what we're doing. But I think we have to be humble in acknowledging actually pandemics set us off course. We went backwards, and we still don't have all the answers. We still don't know exactly how we do this. And I think sometimes we have to remind ourselves that when we set out, we said this would be difficult, and it's still difficult, and it will remain difficult. And therefore, the learning is even more important, because we don't have all the answers to how to do this and how to do it well. What's positive, I think, is we've seen a huge, in the last sort of year or so in particular, a huge acceleration of programming. And sort of, I think, I mean, if I look at the journey of the last 3 years, we've had enough time that zero dose has really become institutionalized and something which everyone is focused on, as Hope spoke to. In the last year, we've seen this acceleration of programming coming out of the pandemic, and the vast majority of Gavi countries now have approved grants really focused on zero dose agenda. And we've seen in those grants a real pivot towards much more focus on zero dose, new strategies, new methods to try and identify missed children and missed communities. And the feedback we've had from the Independent Review Committee at Gavi is there's been a real shift in the quality and the sort of focus of those grants. But I think at the same time, we have to accept we actually still don't know exactly what works. And we don't know whether all that programming is going to lead to the results we hope it will. I think, we had some hypotheses on what we thought would make a difference. We knew we wanted to pivot much more to focus on demand-side interventions, really figuring out what's preventing people from accessing services in terms of, on the demand side, greater focus on gender-related barriers to immunization, and making sure that we really unpacked how those affected access to immunization. A much more sort of nuanced thinking around service delivery and how we use the whole range of service delivery approaches to reach missed communities, etc. And these are being reflected in what countries are doing with their programming to a greater and lesser extent. But they remain hypotheses, I think. In some places, there's more evidence than others, but they remain, hypotheses. And we need a lot more evidence on what works, what it takes to make that work. And something like gender is a great example, where I think we know in principle that there are key gender-related barriers to reaching missed children. We actually see countries struggling to know in practice what to do about it. And so really understanding, not just what works, but how do you make what works work is important. And also how much it costs to do that. And I think one of the things everyone accepted at the beginning of this journey was the zero-dose agenda will be more expensive than reaching kids who already reached the routine immunization. But how much more expensive remains a big unknown. There's evidence emerging, which we'll hear more about today, which is starting to fill in some of those gaps. But it does then raise questions about sustainability and what are the choices it can be made around, and the trade-offs that can be made around the how we do this that affect that cost. Because at the end of the day, what is fantastic, every zero-dose child reached is a step forward. If that's entirely dependent on external support because it's not sustainable within countries' programs and country systems, then we'll get some short-term gain, but we're not going to get a long-term systems change, which is what we really need to make sure this doesn't return as a problem as funding kind of phases out. So it's really important that we have this learning now, because we're really sort of 3 years late, seeing programs, zero-dose programming start to be implemented at scale after the delays caused by the pandemic. So this will help inform that and adjust that. But it's also when, of course, as an alliance, we are sort of shaping Gavi 6.0. The board approved the strategy in June, but that's essentially one-page document, and there's a lot of details to be filled in underneath it in terms of what will we do differently on the zero-dose agenda and in Gavi 6.0. It's clear that it remains at the heart of the Gavi 6.0 agenda, and we have scope to adjust how we approach it, what we do with it, which will really be shaped over the next 6 to 12 months. And so now is a great time for us also to be taking this learning and saying, given all this, are there things we missed in our 5.0 approaches? Are there things we really want to do differently in 6.0? So the timing is really helpful. And I think what's also great about today is how we're bringing many, many partners together. I mean, the learning is only useful if it's used. And while we in the Secretariat will certainly try and use it, we want it to be used across partners and across levels of the organization. Ultimately, we want it to be used by countries. And that, to be frank, is often where we struggle as an alliance, is how do we ensure that all the knowledge and learning that's generated at a global level really does cascade down to countries. And so I think one of the things I hope comes out of today is not just that we have a great conversation for a few days and we all learn, but we are able to take this back to our institutions and systematically cascade the knowledge down through them, because that's what will take it from being a great academic exercise to being something that really starts to change the way that that we approach the efforts to reach zero-dose children. Maybe the last thing I'll just say is it's also great to see some people who are not immunization people day in, day out in the room. I'd love to see even more, because I think one of the things that we're continuing to struggle with when it comes to the zero-dose agenda is this sense that it's this immunization agenda. And I was having this conversation earlier this year with Bruce Elwood from WHO and saying, zero-dose children are a symptom of flaws and gaps in the health system. That it shouldn't be an immunization agenda. It's an agenda for everyone who cares about making sure that we get universal health coverage, because we know those children are far, far, far less likely to get any routine health services. And so this is, yes, Gavi is particularly focused on it, and it's been driven to an extent primarily by the immunization community, but it ought to be a shared agenda. This needs to be something where if we succeed in reaching these children with immunization, that's great. But it's also a failure if we only succeed in reaching them with immunization, because there's many, many other things these communities need. They have some of the greatest and most acute needs for all the other services as well. They have some of the highest burden of other infectious and diseases and health conditions. And so if we put all this effort into reaching them and only come with vaccines as a health community, we will have failed. And so I really hope that as we leave the room after a couple of days, we're also able to engage with our broader communities, our broader organizations, to make sure that they are learning from this too, and that this can serve for us to continue to work more closely together to bring integrated primary healthcare services to these communities. The Lusaka agenda is a great opportunity to do that, but we need to move from sort of talking about how we're going to do it to actually starting to do it. And I think there's an opportunity coming out of the room today to really do that better. So thank you. Really looking forward to learning what we're learning and turning that into action.
Thanks a lot, Alex. Thanks a lot, Hope, for these opening remarks. I think that set us in a good direction for the discussions today. And